Tinnitus is the perception of noise or ringing in the ears when there is no external sound present. The most common cause of tinnitus is noise-induced hearing loss. It's responsible around 40% of cases. This condition is especially prevalent in young individuals or those working in noisy environments. Exposure to loud music, concerts, and machinery noise can damage the delicate hair cells responsible for sound reception. This damage causes them to send distorted signals to the brain, which are perceived as tinnitus. Safe noise levels are considered to be under 70 decibels, which includes normal talking, quiet libraries, and household appliances. Noise levels between 70 to 85 decibels are deemed safe for up to 8 hours and include traffic noise and washing machines. Noise levels of 118 decibels can cause damage within several hours, typical of motorcycles, loud music, and concerts. Music players can reach up to 115 decibels. Exposure to noise above 140 decibels can cause instant and permanent hearing damage, including noises like gunshots and explosions. In most cases, noise-induced hearing loss can recover within 48 hours, as this time is needed for the hair cells to repair themselves. The second most common cause of tinnitus is age-related hearing loss, known as presbycusis, accounting for 20 to 30% of cases. Over time, the natural aging process can damage and deteriorate the inner ear structures, leading to hearing loss and sometimes tinnitus. The best ways to prevent presbycusis include reducing noise exposure, maintaining a healthy weight and physical activity, and managing chronic diseases such as diabetes and hypertension, as they can increase the risk of age-related hearing loss. Another common cause of tinnitus is middle ear infections. Inflammation in the ear can disrupt normal ear functioning. A typical scenario is an ear infection in children following a common cold. The child may experience ear pain, noise in the ear, and a feeling of fullness. Conversely, a classic example of ear canal blockage is earwax formation. Naturally occurring earwax can harden in the ear canal, obstructing hearing. Overuse of earbuds, earplugs, or improper cleaning can exacerbate this condition. Hearing usually returns to normal once the causative agent is removed or the ear infection subsides. Medications can also be a cause of tinnitus or noise in the ears. Common medications that may lead to tinnitus include aspirin, certain antibiotics, loop diuretics, and antidepressants. A classic example of a medication that can cause tinnitus is aspirin. Typically, the tinnitus induced by aspirin is temporary and subsides once the treatment is stopped. However, in rare cases, particularly when aspirin is taken chronically in high doses, tinnitus can become permanent. The underlying cause is believed to be related to changes in blood flow and fluid balance in the inner ear, affecting the function of the hair cells. Another common medication group that can cause tinnitus is aminoglycosides, such as gentamicin, known for their ototoxic properties. These medications can damage the inner ear, particularly in high doses or prolonged usage, affecting both the auditory, hearing, and vestibular, balance, parts of the ear. This can lead to tinnitus and even hearing loss. To prevent medication-induced tinnitus, it is crucial to use these medications at the lowest effective dosage. Meniere's disease is another condition that causes noise in the ears, although it is not very common. Accounting for about 0.2% of the global population, Meniere's disease results in damage to the inner ear. Its classical symptoms include vertigo, dizzy spells, hearing loss, and tinnitus. The exact cause of Meniere's disease is unknown, but it is believed to involve abnormal fluid buildup in the inner ear. This disrupts the normal balance and hearing signals between the ear and the brain, leading to the symptoms of Meniere's disease. Managing Meniere's disease often involves dietary modifications, such as salt restriction and avoiding alcohol and caffeine, which can somewhat improve the condition. Steroid injections in the middle ear and the use of diuretics to reduce fluid retention are other treatment options. Additionally, Antivertigo medications like diazepam are used to alleviate vertigo during attacks.